In this session, the Apply Club Health is trying out a new format. So the 3 consultants in the team, as I mentioned before, will explore in brief impulses talks how their anthropology backgrounds are shaping their work today in consulting. And you as an audience are invited to contribute with your own examples and learnings. So a couple of things for housekeeping before we start. Yeah, as mentioned before, it would be great if people can maybe mute themselves during the presentations, but you're more than welcome to keep their cameras on so that people, we can all see each other. It would be nice for the speakers as well. For the Q&A, this time we're asking you to please raise your hand so we can actually have like a talking, like lively discussion. But also you're welcome to use the chat to type any questions that you might have after the presentations. And I'm just going to read them out to our speakers. If there is any immediate issue, something technical, something that is not quite working, please raise your hand, put it in the chat. Somebody from the team is going to come back to you as soon as possible. We are going to record the presentation and the discussion is not going to be recorded to ensure everybody feels as free as possible to speak about anything they want. Are there any questions that I can address before I open the floor to our speakers? If not, I'll pass the words to Beth as the first speaker today. Thank you.
Great, thanks, Gaia. Let me just share my screen. Perfect. So my name is Beth Vale. I'm an applied anthropologist and co-lead at Percept, a transdisciplinary social impact advisory firm that is rooted here in South Africa, but has an international network of partners and clients working towards a healthier, more resilient world. Central to Percept's organizational culture is an intuition that is also core to anthropology, that human action and relationships are born out of a social ecology. This means that the ability of each of us to show up as whole people, to develop strong and enduring professional relationships, and to do our best work is dependent on an environment that nurtures this. Percept is a deliberately small, collaborative team. We reject the hierarchies and shareholder extraction that often characterize corporate culture, but also the bureaucracy and martyrdom that pervades NPO culture, and instead aim to model the mutually cooperative society that we'd like to see. I'll discuss 3 other tenets of anthropology and how we have mobilized them in our healthcare consulting. The first is the emic perspective, which is to read the world from the insider's point of view. That means getting to grips with how people make sense of health and illness, as well as the social, political, and cultural stakes involved in healthcare and health seeking. Without an understanding of the ways that health interventions are interpreted, remade, and resisted by those who are expected to use or deliver them, our efforts to advance human health go to waste. We also risk sidelining the expertise of health workers and people living with illness who have amassed critical embodied knowledge of how health is made or broken. Percept co-leads a Global South collaborative that seeks to advance value-based maternal healthcare by foregrounding an emic perspective. Value-based care involves working with providers, governments, and insurers to fundamentally reorganize healthcare delivery and financing around metrics that matter to pregnant women and mothers. Through anthropologically attuned research, we've sought to understand how women in different contexts experience maternal health care, what they value in their healthcare providers, and what quality of life means to them. Each of these self-reported measures has implications for how women engage healthcare, as well as their own and their child's long-term health. Informed by an emic perspective, we are co-creating context-specific, implementable sets of patient-reported outcome measures to evaluate and iteratively improve maternal health care. In another project, Percept undertook a Gates-funded telehealth pilot among patients with uncontrolled sugar levels. Participants received 3 months of telephonic glucose monitoring and psychosocial support. Some commentators have celebrated telehealth for supporting self-management. Others have condemned the extended reach of surveillance and the medical gaze. But what was the emic perspective? Our qualitative research showed that despite being in person, public healthcare services were often inhuman with little person-to-person connection. Health workers had time scarcity while health seekers spent full days in long queues. The result was a long wait followed by a hurried consultation. Participants described how phone calls from their doctor unsettled the provider-patient hierarchy. There was less kind of assertion of health worker authority, more attention to the person, not just the patient, and greater reciprocity in conversations. The pilot achieved a significant 2 to 4% reduction in HbA1c levels. The second tenet is holism. For anthropologists, making sense of health behavior and health outcomes would mean locating them within a wider social context in which they are produced. And that's in stark contrast to a biomedical model in which the individual is the locus of diagnosis and intervention and is expected to take responsibility for fixing their own health. Anthropologists can help articulate the social, cultural, environmental, and economic systems that shape human health, illustrating that no one's health is made in isolation. Holism informed Percept's work on medico-legal claims for cerebral palsy. South Africa has had a substantial rise in claims where CP, cerebral palsy, is a direct result of negligent care during pregnancy and birth. While improving healthcare quality, government must also cost medico-legal payouts in a way that is both just for claimants and cost-effective for the public health budget. Through a series of interviews with parents and guardians of children with CP, we were able to bring into focus the costs and context of CP caregiving, which extend beyond the child to their families. Caregivers of children with CP can struggle to earn an income, experience physical and mental health challenges, and become targets of stigma. Caregivers that received medico-legal payouts were often encouraged to move to the suburbs where they'd be closer to health services, but in the process lost community support and struggled with inflated costs of living. Current claims processes don't factor in the changing needs of families caring for children with CP and restrict budget to the narrowly defined needs of the child. Since the well-being of children with CP is tied to that of their caregivers, it's imperative that they receive a more holistic package of support. If a holistic emic perspective is anthropology's theoretical orientation, then storytelling is its method. Asking what the human story is, how its pieces fit together, and what larger meaning can be made of it is foundational to how anthropologists gather, construct, analyze, and communicate data. Through storytelling, we can translate austere technical problems into digestible narratives that ignite empathy and action. In a series of briefs on non-communicable diseases in South Africa, Percept combined actuarial analysis with ethnographic vignettes. While quantitative analysis illustrated the extent of need and the pace of change over time, the vignette showed how this reality was playing out in homes and communities as a reflection of life conditions rather than so-called lifestyles. Finally, Percept's thriving rests on approaching our clients with some level of ethnographic intuition. So that means treating our clients as experts of their own experience, moving with humility and reflexivity, and coming to an understanding of their values and interests. So I'm going to stop there and looking forward to our discussion because I know that we're running out of tight time and I want my fellow presenters to have equal space. So thanks, Gaia, and thanks, everyone.
Thank you so much, Beth. That was great. Yeah, without further ado, I'll move to Heinrich.
Well, hello and welcome. I'm glad you all could join us. I haven't seen Beth's presentation either, and I find it interesting how we both focus on different issues, but also name similar issues differently. So you will see what I mean in a second. My name is Heinrich Schwartz. I'm one of the co-founders of the Apply Club Health. I've also been an innovation consultant for about 15 years, running my own, and I forgot to move you forward, running my own consultancy for about 10 years out of Hamburg, Germany, and together with a colleague, Moritz Geldner, now focusing on healthcare for about 4 years. I've done that before on healthcare, but now it's entirely the focus on healthcare. I've experienced as a design researcher for about 25 years. That explains the white hair on my face. I've studied psychology, cultural studies, and science technology studies in Germany, in the US. So as you can see, I'm not a real anthropologist because I just didn't study in an anthropology program, but I have studied with anthropologists for about 10 years, and I feel as an anthropologist, if that counts for anything. Now, what is the type of work that I do? My focus is on people-centric innovation, and that means people as engines of innovation in many different ways. I've mainly worked with industry clients, pharmaceutical companies, medical technology or medical product companies, also some startups. The type of products usually are about identifying opportunities for new treatments or products, or understanding limitations and improving current treatments or products or current user experience. In the end, it's often about improving quality of life for patients or quality of work of healthcare professionals to bridge gaps in care. Over the years, I've worked quite in a number of disease areas and treatment areas, which I don't need to get into right now. Let's go to what I call Anthro powers, how they allow me to see, understand, and maybe do things differently. First of all, I have to say it's a challenge to talk about this in less than 8 minutes, maybe. So forgive me if this is mainly an appetizer and really doesn't go into details too much. But first, I want to say that I see healthcare as special. It has special challenges. It will require special skills and approaches. So for one, it's a complex ecosystem of people. Second, it's intricate problems that we're dealing with that involve interwoven flows of very different things, from knowledge to skills over money, morals, power, regulations, emotions, identities, and suffering, of course. And then it has, compared to other fields and other industry, very high stakes. It's really close to the human core. Things do matter. I identified four, I could call it forces or powers: a wider and deeper vision, a view beyond individuals, a sensitivity to difference, and the magic of stories. And this is where Beth, we used the same kind of wording. I think we used other wordings for other things, but that's interesting to see as well. There are other powers that we could talk about, and there are other powers beyond anthropology that are also needed, but this is not the place for this. So let me talk about the first one, the wider and deeper vision, which is mainly about uncovering the hidden and to find relevant and unique solutions from that. We all know that for anthropologists, it's important to be able to see things differently, to uncover what's hidden, to see motives that are not obvious, that can explain people's actions and motivations on a deeper level, but also on a broader level, connected to different things. How do I apply that? It's really mainly in the framing of projects, especially the whole research design and the insights generation process. You know, what type of research, people work with observations, for example, and then looking for everyday practices, for emotional needs, for aspirations. And that allows me to create relevant and novel solutions, which is crucial for innovation, of course, to anticipate future behavior based on current underlying unmet needs or practices or motives. I want to give you a brief example. A pharma company developed a new medicine for a rare chronic disease. Clinical trials showed clinical improvements or medical improvements over existing drugs, but the client also wanted to show that their drug improved the quality of life of patients, which was still often severely reduced through that condition. The challenge is that people with this disease tend to be very grateful once they receive the diagnosis and the treatment, which could be a long ordeal. So they don't want to complain and they downplay their type of problem. A research approach was required to spend a lot of time with them, more than a day with each patient at their homes, to see firsthand what their life is like and not only hear it through their words, and having long conversations with them to get to the bottom of things and for them to open up. So we learned that the disease could actually still disrupt people's lives quite heavily on many levels despite treatments. We were also meeting with friends and relatives of those people with the disease. We were talking to doctors and we were getting patient organizations involved, which showed us also that the support system that they had challenges themselves that were important to address. And this brings us to the next topic, that is the topic of looking beyond individuals, which is, of course, about understanding ecologies. We talked about ecologies just now and their dynamics in order to change behavior and to change organizations. So what we learn from anthropology is, of course, thinking beyond the individual, thinking about ecologies and cultures, and thinking about the dynamics that happen between them, which shows us why structures can be fairly sticky and how decision-making is not rational or irrational, but it's really socially complex. I apply that in the research design addressing healthcare ecologies, whom to talk to and who to include in a project, which should be relatives as well. We just talked about this, patient organizations, for other project payers, and the diversity of healthcare professionals and not just doctors, and create stakeholder influence maps that show how people may be affected and how they may support or inhibit change afterwards. So in the end, it helps us to transform organizations when we understand the dynamics and to create interventions that take into account the whole ecosystem. The third power that I identified in my work is the sensitivity to difference, translating strangeness into meaning, and so empowering people to work together. That's, of course, something we all know, sensitivity and respect to difference between people, and then experience in translating those to help people work together and understand each other is what anthropologists do well. In my work, I think it is helping to study and to do research with stigmatized topics that can be particular skin diseases, it can be schizophrenia, it can be diabetes even to some degree that's stigmatized. But it also helps, or I also try to apply it in the way I work with different types of teams or mixed teams, multifunctional teams to design workshops and sprints where it's important to understand that difference. So in the end, that empowers different groups and facilitates collaboration and co-creation. Finally, the magic of stories, or storytelling, as Beth called it, which is about, of course, making messages meaningful and to persuade and inspire, and through that to achieve impact. We know that stories are indispensable and that also journeys are a good way to convey rich and real experiences. Concretely applied, that shows up for me in presentations so that they combine succinct insights, which are also important, but with rich lived experience through anecdotes, through images, through quotes. Also through formats as using patient videos to convey a story, and to build journeys, real user journeys that show problems, but also ideal ones that show the desired solutions. In the end, telling stories helps to be meaningful, to persuade, and hopefully to create lasting impact. Now, a short story about that. A company, a startup that sells home user tests, diagnostic health tests to people like you and me to find out about their vitamin levels or similar. They wanted to understand better how they're processed. They have an online shop could work better. They had the idea that some things didn't work, but others did work. So we created this user journey for people using their tests and buying them that also included how the people interacted with doctors and what they actually did with the results. And this helped them to really understand the different issues that they had to tackle and also in what sequence they had to, because we have this chronological order, and also showed opportunities to help people actually understand the outcomes of the test results, which they often didn't, and to help them change the behavior through coaching videos and so on. So it created new business opportunities for them. To sum up, for me, the Anthro background is a way of seeing, is a mindset in the set of tools and techniques. And this is a short summary. So the wider and deeper vision results in better understanding, and that in better and more relevant solutions. Looking beyond the individuals helps to focus on the ecologies that matter to create real change. The sensitivity to difference helps to translate difference and enable collaboration. And the magic of stories helps to inspire, and through that, to impact. So in one sentence, it's all about understanding deeply in order to transform profoundly. Thank you.
Thank you so much, Harry. That was really, really insightful as well. The last speaker of today, Ute, whenever you're ready, the floor is yours.
Thank you. That has been really interesting. Definitely lots of overlaps, even though we work in quite different contexts between the three of us. So that's really good to see. Yeah, so my name is Ute. I'm also going to have to ask Heine to share my slide due to many tech issues.
Can you see it?
Yes, I can see it. Thank you. So I'm a service designer at a tech consultancy called Opencast. And as the practice lead, I head up a team of designers who work with government clients to design and build digital services. I'm based in Glasgow in Scotland. I grew up in Germany. And in between, I lived in London, Istanbul, Norway, Italy, China, and the Scottish Highlands. I have a master's in anthropology and a master's in design innovation. And I've worked as a service designer for almost 10 years now, 6 of those mostly in health and social care. You can find more of my work on my website if you're curious. So I actually came to anthropology by coincidence, really, and completely fell in love. It's one of the most fascinating and most useful disciplines. And of course, there's the theory and the knowledge, but as the other speakers, what I find most valuable and still use today is actually the mindsets and methods that I learned from anthropology. They shape how I work, how I think, and how I design. Anthropology is often underestimated. I think partly because it's taught with a future in the academic world in mind. And that wasn't really for me, but there was no clear or well-trodden path to applying it beyond academia that I could see or know about as a student. And I wanted to use that deep understanding that anthropology methods give you to do something, to change something. And so I found myself working alongside designers all the time and eventually did a degree in design as well. Interestingly, design can be equally misunderstood, almost in the opposite way to anthropology, of being too practical and only about making things pretty or about aesthetics. And that's why people generally struggle with the idea of service design. So when I tell someone I'm a service designer, rather than say curtains or fashion or chairs, because if you're designing services, what is your product? What's your material? What's the design part? Well, to me, design is really a method for imagining and creating change with intention and in collaboration. And as a service designer, my medium is people, culture, and systems. So really the stuff that we as anthropologists know so well, and what makes up the world around us, including health and social care. Healthcare is a set of processes, interactions, tools, buildings, mindsets, ideas, practices, and of course people. And they're all continuously changing and adapting. So anthropology helps me to understand these and to know that they're not unchangeable natural laws. They're human and they are made. And of course, this means they can be remade, reimagined, and reorganized to work better for people, for the planet, for society. And design helps me to jump into that, to apply, to make something, even when things are uncertain or I don't have all the answers yet that really my anthropological heart would like to have before doing anything. So bringing both together means my work is mostly orchestrating processes and interactions. I create experiences or something that helps people do something, like claim child benefit or book a vaccination appointment. And that sounds a little bit trivial, but bad service design ruins lives. It stops people accessing childcare, healthcare, work, life. So good design isn't a luxury we buy from a design museum shop. It makes or breaks childhoods, careers, equality. And yes, we're maybe just talking about booking appointments, but as someone who worked as a carer as well and has a disability, I had to rely on healthcare systems across the world for most of my life. So it's a topic really close to my heart, and it does really matter that it's designed well and with that deep understanding. I think with all the attention on healthcare, especially now after the pandemic, and also digital innovation reaching that space, it's a real opportunity to put people at its heart and to transform how we live with illness. And that's why health needs design and why design needs anthropology, to consider those big questions, like what ideas or stories will shape how people behave, how they think, how they interact with a product or service that I'm creating, what else needs to change to achieve that impact, what are the unintended consequences, what future are we creating here, and why is this better, or for whom is it better? So those questions is what anthropology makes me ask and helps me unpick. So it just really helps me to think across more layers than just aesthetics or products or services. And in the end, that's what makes me a good designer and a good consultant as well. So to close off, I thought I'd leave you with a thought or a comparison really that I usually use when people ask me about being an anthropologist or a designer or what the combination really means. And to me, the best comparison is that anthropology is to design what physics is to engineering. So I think of it as the underlying knowledge of how the world functions, a bit like what physics teaches. And the engineering part or the design part is applying that knowledge to create something out there in the world, a bridge, a building, a car, a service, a healthcare system. And I feel really strongly that actually all designers should have anthropology as part of their education because of that. And perhaps also all anthropologists should at least be aware about this path into design and to applying their discipline in whatever way. That's me. Thank you.
Thank you so much, Jutta, and thank you so much to all the speakers for their amazing presentations.